Hi, this is an image based question. Okay, so this is a classical picture of a carcinoma which is seen in thyroid. Okay, sometimes they may give history, but it is better to identify it by looking at the picture alone. So this is actually papillary carcinoma thyroid. Let us see some of the high yield points in this topic. So this is the most common thyroid carcinoma and the age group is adult, that is 25 to 50 years, and there will be history of radiation exposure. The hallmark microscopic features of this papillary carcinoma is branching papillae with fibrovascular core. That means there will be finger-like projections like this. These are called branching papillae, which will be lined by the epithelial cells, that is tumor cells, and they will have the central fibrovascular core running. These tumor cells will have nucleus that will show some characteristic features. Some of the features, nuclear features, are ground glass nuclei or orphan annii nuclei, because they compare it to the eye of an cartoon character Orphan Annie. Okay, so that is why they call it as orphan annii nuclei or empty nuclei or ground glass nuclei. They also show nuclear grooves and intranuclear inclusion, which are called as pseudo inclusion. So this is the picture where you can see the character having an empty eye. So that is why they compare it to this orphan annii nuclei. And this inclusion are called as pseudo inclusion, which means they are not true inclusions. Why they are called as pseudo inclusion? Because here the inclusion is because of the invagination of the nuclear membrane into the cytoplasm. So the nuclear membrane will invaginate and they appear like a inclusion, but it is not a true inclusion. That is why it is called a pseudo inclusion. And the next feature is Samoma body. Samoma body are nothing but concentric lamellated structures of calcium deposition. This is seen in many other tumors. But nuclear features are very important as far as papillary carcinoma thyroid is concerned. Thank you.